Knock, knock.
Come in.
Prefer hand hygiene. Hello, hi, my name is Lena. Today I'll be your nurse. I'm going to be inserting a Foley catheter, then at the end of the day I will remove it. And it should take about 10 to 15 minutes. And the reason why I have to insert a Foley catheter in you is because you have some urinary retention, and the Foley catheter will help empty out that urine. Do you have any questions before we begin? Okay. Can you tell me your name and your date of birth?
Asma Salah, April 4th, 2005.
Okay, that's the right patient. And do you have any allergies to iodine or anything?
No.
Oh, okay. I'm going to lift up the bed, make sure I provide privacy, lift up the bed. And I'm going to be performing pericare on you first. So make sure do hand hygiene, and then put on some gloves. Okay, I'm gonna get my wipes and I'll put this under the patient. Can you lift up your leg for me? If the patient is not able to do it, I'll just do it myself. So carefully lift up the legs. Okay, I'll put this under the patient. I'm gonna start doing pericare, go on the outside, and then the other side, and go inside. And then I'll go down the middle. And then I'm gonna throw this in the trash. And then take off my gloves. And I'm gonna perform hand hygiene. And then I'm going to start with opening the sterile field. Just adjust this. So I'm going to put this under the patient. And then I'm going to take my gloves. Before I put it on, make sure I perform hand hygiene. Then open my sterile gloves carefully. Just hand hygiene, and then put on my gloves. Okay, make sure I just only touch the inside, go under my cuff, and then put on my gloves. Okay, and then these both are sterile, so I can just touch this. That's good. And I'm going to put this on top of the patient. And then I'm going to prepare my kit. So I'll put iodine on the cotton balls. Do you have any allergies to iodine?
No.
Okay, sounds good. And then I'm gonna prepare my catheter. So I'll put this to catheter, make sure this is connected. going to make sure I loop the catheter. And then close this. And I'll just put this here for now. I'm going to clean the patient. So I'm going to use my non-dominant hand and put it here. I'm going to use my non-dominant hand, clean the patient, go down, put it here, other side, and then go in the middle, and then other side over here, and then down the middle again, put it here, and then I'll just put this here, and I'll take the catheter and insert it into the patient, make sure I'm close so I have more control. Okay, how does that feel? Just keep going until I see urinary, until I see your urine outputs. Then I see urine output. I'm gonna go another inch. Okay, that's good. There's resistance. I'm going to inflate the balloon. Okay, that's good. I'm gonna take this off. And there's resistance, so it's in the right place. And I'll put this here. And then now I can just take this off and clean up my space. And I'll get rid of all of this. And just put this here for now. Get rid of this, and so I'll just put it here, and then I'll take off my gloves. I'm gonna perform hand hygiene, and I'm gonna make sure the patient's in a comfortable position. So I'll put this patient legs back down. Patient is comfortable, and then I'm going to leave some slack so patient is able to move, and get some piece of tape. So take this here. There's some slack, so that's good. And then I'm going to hang this to a non-movable part of the bed. So I'll just put it here, but it will be a non-movable part. And I'll just put it here, make sure there's no dependable loops. So I'll just put it here because the urine is able to flow, and then I'll clip this here, lower the bed. Okay, so how's it going? Here's your call lights, and I'll come back later to remove it. Do you have any questions for me? The patient is safe and in a comfortable position. Make sure I provide privacy. That's good. And then perform hand hygiene on my way out. And then this is the process of me removing it. So I need to gather my supplies. So I need this to remove it. And also, this is my wipes for pericare and some gloves. So I'm gonna remove the catheter. Knock, knock.
Come in.
Hello, hi, my name is Lena, perform hand hygiene. My name is Lena, and today I'll be your nurse. I'm here to remove your Foley catheter. It should take me like about a couple minutes. So do you have any questions for me?
No.
No? Okay. So I'm gonna drain out the urine. So I'm gonna put on a pair of gloves. First, I'll start with draining out urine. And then I'll just put this under here. And then I'll take this, drain it out, and then measure the urine, and then it's gonna go in the toilet. So that's done. After that, I will just remove my gloves because I will be doing pericare. So I'll do hand hygiene, and then put on a pair of gloves. Oh, first I would put up the bed. Before I do that, so I forgot to mention, but I would put up the bed, and then after I measured everything, so I'm gonna start with pericare. Then I'll get my balloon too. First, I'll take off the tube. So I'll take it off gently. Okay. And then I'll put this in here and get rid of the water. Okay, that's good. I'll just put that here, and I'll gently remove the catheter from the patient closest to them. Okay, how's that?
Good.
Remove everything, and then unclip this. And I already drained out the urine, so I will just throw this in the trash. I'll just put it here for now. And then I will take this off. Perform hand hygiene and put on gloves. I will just get a piece of paper to just put under them. So perform hand hygiene, and then I would get gloves. Okay, I'm going to be, are you able to lift up your legs? I'm going to perform pericare. The patient is not able to, so I will just lift up the patient leg. And then put this under the patient and make sure there's privacy and everything. So then I'll just clean the patient. Inside of it and down the middle. Okay, I'll just throw this in the trash. Take off my gloves. Hand hygiene again, and then put them back into a safe, comfortable position with their legs. Lower the bed, and here's your call light. And if you have any questions for me, let me know. Make sure the patient is private and covered. So here's your call lights, and if you have any questions, let me know. I'm here. Patient is safe and comfortable. Make sure the area is clean. Everything, get rid of everything, so everything is gone. And then hand hygiene. Thank you. I'm gonna